Well, every surgeon in America who does general surgery training, and a colorectal surgeon is a general surgeon before they're a colorectal surgeon, will find themselves engaged in the role of transplant surgery. It's a rotation that we do. I personally have performed multiple transplant type operations, both in the procurement of organs and then also in the transport and the implantation of these organs. So I will tell you, it was very distressing was the news from, I guess, last week, almost 2 weeks ago now, that basically said for the last 2 or 3 years, there has been an egregious breach in protocol to the point where I wonder if we are in China or are we in America, where in certain states, Texas is not among them, but there were several states, Kentucky, Southwest Ohio, Virginia in particular, when someone suffers brain death. Well, there's a number of different ways that we know this has happened. Number one, you stick an EEG on their brains, there's no brainwave activity. The second thing that you can do is an angiogram of the brain. There's no blood flow to the brain. Like those two things happen. There are no reflexes. You turn off the ventilator, they don't spontaneously make an attempt to breathe. There's a number of different things that happen that allows us to say this person is only alive because they're on artificial breathing apparatus. Like the heart will continue to pump as long as it has oxygen. It's an automated organ. It has its own pacemaker to it. And as long as it's oxygenated, it will continue to beat. Shut off the oxygen, the heart will stop. Living ceases. And now you're heart dead and brain dead. The brain dead individual who is on a ventilator only has a heart rate and blood pressure because we're keeping that artificially happening. And there are a series of tests. And it's not just done by one doctor who comes in there and does these 3 tests. Like there's a committee. And it's, it's the nurses and the pulmonary respiratory therapists and the neurologists and the surgeons. Apparently, in this particular part of the country, their transplant network started with consultation from the transplant team. And they sort of took over the care of the patients. And there wasn't this emotional, brain racking, is this person alive or dead conversation. They just took patients, even though family members, nurses, respiratory therapists, and other doctors recognized the patient still had reflexes, and then took them for organ harvesting. Where is the sanctity of this? Is an alive person, and we can have an argument about whether or not the patient wants to pull life support because their loved one would not want to live in a vegetative state, and they're in a vegetative state. But someone who has EEG findings and blood flow to the brain and reflexes still technically is a living human being. And you can choose to say, we're not going to keep them artificially alive. That's a different debate than we tra-la. We're just going to take them to the operating room and haul them out. 30% of the patients in this transplant network were showing signs of neurologic life when they were taken for organ procurement. It is disgusting. Thank God someone stepped in. And I do want to, I guess, offer at least some form of professional sanction to the world of transplantation, because some people saw this and thought, geez, I'm taking my name off the transplant list, or I'll never donate my body, or I'll never donate my family for organ harvesting, quote unquote. And I would tell you to think in a different way about this. I do believe in America, this is an outlier. This is some kind of communist China kind of behavior. And I believe the people involved need prison time over this personally. I don't know if it'll come to that, but certainly I believe investigations are to be advocated. I do believe if you are unfortunate enough to be staring at a loved one and you're talking to doctors who say, I believe they're brain dead, ask for second opinions, ask for third opinions, ask for, every hospital has an ethics committee. You should not be meeting the transplant team before you've had these second and third opinions in an ethics committee kind of a conversation. There should be neurologists involved, the nurses, the physical therapists, the respiratory therapist, the trauma surgeon you're dealing with, all should be on board, and then get your second and third opinions, and then get an ethics committee involved. It reflects very poorly on my profession. So have faith. There's still some good ones out there. But always ask your second opinion, always. It's never an insult to anyone.